Hey everybody, Dr. Vidan here, and today I found this information from Harvard Health Publishing. So Harvard Medical School published something recently, and it talks about the fact of where to turn for low back pain. And I love this, because they're talking about chiropractic. They said a chiropractor can help you resolve your problems of low back pain. Now that's from Harvard Health. That's their online publication that Harvard uses, that Harvard Medical School uses. They said, where can you turn for low back pain? It's chiropractic care can help resolve the problem. It says a lot of times you might be wondering where you can turn whenever you start experiencing things like aches and twinges in the low back that people start to get on occasion. Well, they said flat out, they said chiropractic can serve as the entry point for back pain, that they can help you resolve the problem that you're having. I love that because, look, let's face it, what a lot of us are doing, and a lot of people out now, right now, what a lot of people are doing is they're taking opioids, they're taking drugs, they're taking medications in order to cover up the symptoms and not actually correct the problem that's going on there. A lot of times what it found is instead that, look, we see a lot of times that there are structural problems causing these types of things, where it causes sprains, strains, herniated discs, all of those kind of things. That chiropractic, it says right there in the Harvard review, it says chiropractic care is great for helping with this. Now, we talked about opioids, I just mentioned that. One thing that I want you to consider is this, is that there was another study that was done here by, it looks like CBC, and they were done, and they said that up to 26% said that this study suggests that as many as 26% of patients taking opioids become addicted to opioids after their first time that it's being prescribed to them. So after the first time it's being prescribed to them, they become addicted to opioids. Now, for some people, they might think that doesn't even sound like that many. 26%, come on, Dr. Vidan, that doesn't sound like that big of a deal. Well, it is. Think of it this way. If 4 of your family members, 4 of your friends, 4 of your coworkers are prescribed opioids, that means that 1 out of those 4 have a chance of being a 26% chance. So that means 1 of those 4 people are going to be addicted to those opioids after just the first time of it being prescribed to them. That's huge when you think about that. That's 1 in 4 people that you love and care about that have a chance of being addicted to these drugs. The other thing is they said that the vast majority of the time they're prescribed for things like low back pain, neck pain, headaches. Well, what is it that we as chiropractors, just based on what the Harvard Medical said, it says chiropractic can help with that low back pain. So why put yourself in that kind of risk? Why have your family be in risk for that? Don't. I know that myself here in St. Louis, we strive to provide the very best chiropractic care here in St. Louis that we possibly can. And I know that there's chiropractors all over the United States and all over the world that are wanting to do that same thing. They want to provide the very best chiropractic care that they possibly can to help you and your family to not have to have problems and not have to deal with being a statistic. We don't want you to be a statistic. I don't want you to be a statistic. I don't want you to be addicted to drugs or medications or anything else, especially whenever there's something that we can do about it. When you consider those things, you have to really consider what Harvard said. We have to consider what it is that can be done, structurally making changes, and see what we can do to help you too. If you're dealing with any of those problems, let us know. We would love to see what we can do to help you. We would love to see what we can do to help resolve those problems, like what Harvard Medical said that we can do to help you. And if you're here in St. Louis, give us a call. If you're anywhere else in the United States, we have great chiropractors all over just waiting to help you. All right, everybody, I'm Dr. Vidan. Thank you for listening to this. And if you have any questions at all, let us know. And I will be sure to post here. I'll be sure to post the research that we have here that supports all this so that you can look at it yourself and you can see what it says for yourself. All right, everybody, thanks for joining us.